Are you able to see the PowerPoint at this point?
Yes, 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 yes.
Okay, great, great, great. Thank you, and thank you for your patience on that technological interruption. Okay, so today's topic will be perspectives of geography and geographical mapping, influences and impacts of geography on health. And so for this international conference, as I wanted to share, my name is Audrey Bowler Johnson. I'm a pharmacist in Tallahassee, Florida, in the United States. My disclosure, this presentation is for general information use and basic knowledge. The presenter is not sponsored or receiving benefits from any entity expressed in the presentation. So what is geomapping and how does it work? So for our grand audience and some of you that may be expertise in this arena, however, we do have those that are in attendance that are not. So we will expand and do some general housekeeping overview first. So geomapping essentially is the collection of data from a geographic area. And that data collection may vary based on the collection of information that's being desired. For the purpose of this conversation, we will be honing in on different perspectives from the health arena. Geomapping can be narrowed down by the area, or it can be very vast in the data sets. They can provide the visual layout, different designed instrumentations that display different areas, regions, drill down, and it's just an amazing technique and concept. So what we do know is 60% of our health is influenced by our environment. And you'll see through the presentation, we'll talk about some of those environmental influences, which is a part of geography by region. And we'll see how it affects health and the movement of from one region to the next and the influences based on some of the basic elements. So geographic information systems are GIS systems. They're integrated hardware and software data that they capture data and they allow that data to be manipulated and analyzed from a geographical reference points. And there's various systems and software programs by different providers and different vendors, but the system itself is very instrumental in allowing us to geographically lay out and hone in on data and analyze data points and data sets regarding health and hotspots. So when we talk about geospatial, which is another term for geomapping, that also indicates pretty much in 4 categories where areas that we're really focusing on to collect this data and utilize the GIS systems for. So that in the health, we look at from public health resources, so we can identify if there are any hotspots or diseases that are relevant or more prevalent in a particular region or particular area. And then we'll look at some social determinant factors of health. It could be water quality, it could be the environment, as far as construction, the land that's in that respective area. For example, in the United States, we actually have some research that has evolved from honing in on health by zip code. And when we say zip code, that's a segregated area of housing residential segment. So what they identified geographically by those zip codes is there were an increase in numbers of respective illnesses, say respiratory illnesses, clinical situations that presented with chronic pulmonary obstructive disorder, more increase of asthma, more increase of respiratory infections that presented. And so they looked at that these number of patients had a commonality of data being from a respective zip code. You analyze then and say, let's look at the environment of the geography of that space and hone in to see Is there a particular landfill or water retention pond? Has there been any fumes that were expelled by either a natural or chemical disaster or such? And so that's just an example of how this spatial data is utilized to analyze and evaluate what may be taking place. So why is geomapping used in healthcare? Because, as we shared, it provides vulnerable identification of data sets that can be identified. Vulnerable populations. Was it aggregated data in a particular region for elderly patients? Or was it prevalent for younger adults? And so you'll see the data sets actually even be extrapolated, not only just by condition and or microorganisms or viral that may have presented, but also drill down by gender and age and race, because those factors are other data sets within the geomapping that the GIS systems is capable of. So some other benefits that the geomapping gives us is we can look at the aggregate data. We can look at risk factors by particular region as well. So the risk factors may be increased in areas that have more industry or perhaps a higher population of people in a dense area where communicable diseases can be more airborne and spread more rapidly. The geomapping system process also helps us in healthcare so we can trend data and we can track and see what's actually going on. And if nothing gave us a bigger perspective of geomapping, tracking, and trending, COVID-19 really gave us insight and heightened awareness and utilization of geomapping and GIS systems. As we watched the global spread of a virus, because now we're a lot more fluid in how we travel internationally than we did years before. And when I say years before, probably decades before. We've definitely been traveling internationally for many, many years, but it is a lot more prevalent and a lot more fluid in international traveling and going abroad very easily now. So thus, anything that presents in a particular region is more probable. The probability is increased to be exposed into a different region, a different geographical global space. And so this geomapping used in healthcare allows us to also look at where we need to deploy treatments, because now we've identified hotspots, so we've identified there's an elevation of increase of cancer or respiratory infections. Perhaps a communicable disease is going around and we need to increase the number of vaccines that are expelled to that particular region or area. And so these are just some of the benefits that geomapping has afforded healthcare as we continue to advance and integrate it into health. So how does geomapping of diseases, how it's utilized? They use it for planning. I do reference again COVID-19 as they had already been planning to be preventive in the case of a global exposure. However, those efforts were ceased, and now we present and this move forward. So geomapping affords opportunity to conduct planning and also be responsive, because it is identified and it gives us a visualization of a dense exposure or prevalence in a particular region or area. It assists with the recovery, because as those numbers start to trend down, we see what the recovery efforts need to be. So this data that comes in geomapping goes highs and lows. As you can see, we'll look at the global map in the middle that is showing a red zone area that is more concentrated with the data that they were identifying of disease prevalence in that region. But it had not made it down to the blue segment, which is the lower quadrant. You can see the color shift is changing. However, on this mapping, you do identify, if you look at the center map, that there are redding presentations throughout the entire space. So this is how geomapping is actually utilized, and just wanted to use that because we do need it significantly within the public health sector. So some of those geospatial, when we were talking about geomapping and spatial being interchanged in terminology, are health, environment, community. These are, when we say spatial, we're talking about particular categories and data sets that they're looking at, and different tools and communities where outbreaks may present. And what is it a high dense population based on environment? Global warming. Now we see that different regions, based on the environment, as we said, 60% of your health is influenced by your environment. Is there a more moisture? Is there higher humidity geographically, where there's more water, bodies of water in this particular region? In the United States, we have out west, in our west quadrant of the United States, it's a lot drier. There's less water, and so there's less humidity. So the bacteria, viruses, and diseases that present in those regions will present differently than those that are populated with a more humidity, a humid area. So this is just another global graphic of a geomapping model that was showing, this is by the CDC, that shows a geographic distribution of HDV infection. And as you can see, the coloration, the color code key model in the bottom left corner or the bottom of the screen shows where the red represents high, yellow intermediate distribution of infection, green being low, very low, and respective as you see the key code at the bottom. And so this is how collectively the data is pulled together to see where the resources need to be allocated to, where more review and assessment needs to be taking place based on the presentation that the models afford us in the GIS system. So who's involved in this GeoHealth model? Well, it's an interdisciplinary group. It is not just geographers. There's an epidemiologist, because they understand how bacteria and environments influence the spread, growth, mutation, and those factors. You have public health experts that are also a part of a GeoHealth team, because they too analyze data and can see what is actually taking place in a particular region by communities. So when we talk about public health experts, we mainly think about communities of people. And that community, going back to data sets, could be community by area, or it could be community by age, or community, using that terminology, just a group of persons in a common area or have a commonality factor. Environmental scientists are a part of the GeoHealth team, because they contribute their expertise and knowledge from the environmental perspective, and waves and shifts of seasons, patterns. Different regions present with different geo influences based on their environment in which is there. I can use the United States as an example. In the southeast quadrant, we contend with hurricanes and spread of disease if there was some destruction there. In the west, far west, they have earthquakes. And because of the geography and the environmental influences and changes and shifts in the environmentalists, people, they anticipate what needs to be integrated as we're evaluating health relative to data sets of geohealth or geomapping, geographic mapping. Medical professionals contribute their expertise in regarding to treatment of disease, the human body, the human factor element. And then there are other data and instrumental researchers that actually are part of this collaborative team. So collectively, GeoHealth is not segregated or just allocated to one arena of professionals, be it environmentalists or epidemiologists, there's actually a interdisciplinary team because each component of the spread and the trends and the presentations, as well as the treatments, recovery, all of those factors have an element from any of these arenas. So let's move a little further. So the World Health Organization, WHO, they use geodata all the time because they are the World Health Statistics provider of what's going on globally for the health industry to be aware of presentation of diseases and spread and potential trends and changes, what's anticipated. So it looks at human geography as well as the geographic environmental layout. And this is referenced as environmental health sciences. So environmental health sciences actually came into play back in the 1950s. But as we have progressed in population and building and more industry and global traveling and international, it has really continues to increase as the population has increased. And you'll see some of the graphings on the projections from this study and report. So it is listed in the references for Dr. Betkar to provide so that you can download this potential. I'll go back to the slide if you wanted to make reference. It is entitled the Geo Data, and it is used by the World Health Organization. And they have some great information, that research that was done geographically, data sets that break out by conditions and environment, regions, etc. So the researchers began to study how the environment exposure actually impacts health. And so the primary components is air, the air quality in a particular arena, environment, water quality, and land use. Those all contribute to health outcomes. And so when you think about land, I can specifically share, there was a particular community, a group, segregated, large group, a range of people in a zip code, and they had a number of deaths, 10 years, in their probably third quadrant of life that presented with cancer or had died from cancer. And so once they identified that the underlying cause of death for my mother, his father, the neighbor's nephew was cancer, they began to look at the land and what's in the environment around that community. There was a railroad track that the trains go over. So the wood that is under the railroad track actually releases gaseous fumes of arsenic into the environment. So that affects the air quality. Also within a 2 mile or 3 mile radius, I don't remember the exact range of distance, was a landfill where all of the depositing of soil and trash and garbage would be disposed and just covered and dropped and covered and dropped and covered. Those two chemically let off fumes and toxins that affect the air quality. So between the land and the air for that community, it was a compounded effect of environmental health that led them to identify that the number of cancers that had taken place and deaths for that community had been influenced by the railroad track and the landfill, which was environmental. So that actually is an example, just kind of a scenario to give you a validating how water, air, and land contribute to health outcomes. And water quality, we know, carries a lot of bacteria. And if it's not great water quality, it can affect, because we are a large percentage of our body is water, and we need water consumption for our being, our daily being, our innate being, We use water to cook. We use water to bathe. We use water to mix. We use water to consume medications. It's water is a huge proponent. So water quality is very influential on health. And so it brings us into predictive medicine. Predictive medicine also utilizes geodata, and they analyze the influences and the impacts of environment relative to the presentation of disease or the progression of disease. Similar to the case that I just shared with you about that respective community. And I hope this is entertaining. I hope this is informative for you, for those of you that are not familiar with the geography. So we'll dive just slightly into a couple of those elements. Let's talk about air quality. And air quality is indoor and outdoor air pollution. Can cause respiratory issues. They can affect your cardiovascular system, and other diseases can be burdensome to morbidity and mortality worldwide. Air quality. And in the United States, we used to have a lot of industries in the 40s and 50s and 60s, 19 as far as time. And as it was more shared that the release of those gases and release of smokes and burn-offs was pollutants in the air, causing a number of respiratory issues and health issues in the community in range of areas. Also, the air, the toxins and combustion that was coming out of vehicles, out of cars, was expelling gaseous fumes that were also contributing to the negative influence and negative impact on air quality. And thus, regulations, federal, state, and local regulations politically have to get involved to change policies and put protections in place that coincide with the benefiting health. So policies that take place in your political sector do have an impact and an influence on health outcomes. So it goes back to that multidisciplinary teams and integration of people working together collectively for the betterment of outcomes in the environment, in the geography, in the geospace of where they are. So this was a data set that I pulled out of the report that I was sharing that the World Health Organization conducted on geodata, and they spoke about the air quality. Oh, we have a hand raised. Dr. Picard, would you like me to wait or would you like me to answer now?
No, no, no. You have to continue. They by mistake did hand raise, or they will discuss after your speech. Okay.
Thank you, sir. Okay. So the data sets in this particular air quality impacts it gives us numbers regarding, and I did color coded so you can match the graph and the chart. Chronic obstructive pulmonary disease is the charting that's in blue. And at the bottom of the graph, you can see it ranged them. And they broke this out, as we talked about earlier, data sets by age group. And they saw more prevalence of chronic obstructive pulmonary disease in patients between the age of 50 and over versus those that were 25 to 35. You can see that on the data chart. The lower respiratory infections were more prevalent in the younger age, were more prevalent in the children that were 0 to 15, then it plateaued, and then it peaks up again for that elderly population, respectively. So it goes back to what we mentioned earlier in the presentation, that data sets in regards to geomapping and the GIS, the Geography Instrumentation Systems, helps drill down data not only by region and location, but those data sets also by persons and age, so we can get a better feel of what's going on with the disease trend and tracking and trending. Lower respiratory stroke, we talked about the cardiovascular system being affected by air quality. So it is also in their reporting as well. and other diseases and conditions that present it, to include lung cancer, bronchitis, etc. So that's a little chart on air impacts of air quality that were presented. So in this geographic, let's go now to the same layout between air, water, and land. Let's look at air water quality. So World Health Organization looks at it, and they use this acronym called WASH. And the acronym WASH actually represents water sanitation and hygiene. So 58% of the wastewater in the United States was safely treated, in versus based on the data they collected in 2022. 58% was treated. But what happened to the other 42% of water that's not treated? And what level of impact did that have on health, and does it have on health? We do have some areas and regions in the United States that have revealed by region or by area that their water pipe system is contaminated by old pipings and metals that have corroded and are now releasing, toxins and metals and rustic, etc. And is not of good quality, and the treatment plant failed. So they were without clean water for months. And this matter has been actually now going on for years for them to rebuild and replace the water sanitation system for that particular city. That geo health, those numbers are still being collected, but they will see an increase in various conditions and disease prevalence secondary to the water sanitation system being compromised. So here's a graph that was also in the World Health Organization's reporting, where they talked about in the region of Africa, because they are the World Health Organization. And as I share with you, this is a global reporting and statistic that they did. So they looked at the safely managing of drinking water. We'll look at that one for the sake of presentation in blue. So in Africa, the proportion of the pollution was lower in the African region versus regions of America, and then the Mediterranean versus the European, versus how they were safely managing drinking water. So safely managing drinking water was very low in the African regions, and safely managing drinking water services in regions of America was near 80. But then in the Eastern Mediterranean region, it's lower. And you'll see it spike back up in the European model, and no data in the Southeastern Asia region was reported, or the Pacific. And then globally, this is where the results are. So I just wanted to insert this graph for the presentation's sake to see how the data comparatives are being done with the geomapping and the data sets that are spatial data that's being collected. So we talk about mortality rate that were attributed to the WASH, meaning the water sanitation and hygiene. Mortality in the African region was a lot higher than it was in the regions of America, based on the water and hygiene and sanitation. So I hope that this was a very informative slide regarding geomapping and how they collect the data and did the spatial presentation. So just as a quick review, they did the geomapping, and we see that some of the non-communicable diseases. So even though geography talks about landmass in its general term and sense, and the geomapping is different regions, everything is not just airborne. It can be environment. And those are non-communicable conditions that are secondary to geo-environment factors, such as stroke, ischemia, the bronchial lung cancer, those things. And then we do have the communicable diseases that circulate in the environment, like we said, the flu, COVID, things that are airborne and can be easily transmitted from person to person or carried through the environment that are very burdensome. So we have two different categories, and I do think the second presenter will be presenting on some of the conditions more specifically. But for the sake of this presentation, I wanted to share that geography and geomapping by who did look at these data sets for information. And so another one of the reference points that you may find interesting to expand this information for you is the journal, like that GeoHealth has been provided on some platforms, the International Society of Disease Surveillance. They work side by side and they publish and disseminate work based on geography and health. So you will be able to find probably some of the similar data sets that the World Health Organization presented in theirs. However, it will be more focused on disease surveillance because that is their mission and focus. So here are some of the references, and I encourage you to go out and expand your knowledge a little further as more geography and geohealth and geospatial, especially in medicine and health, have increased significantly as we become a more fluid, global, moving people, and as well as the environment and global warming, more construction, less trees. The environment is not able to recover itself as easily. So that is the presentation as stands, and welcome to any questions or follow-up or review, Dr. Bekar, that you seem necessary.
Thank you, Andrew Johnson, madam. From last more than half an hour, you are discussing with us on the topic geographical mapping, how it will be helpful to our health. The data collected by you and the research is so much informative. Those who are out of geography but health geography is useful to all. How this subject is useful to cover, to collect data and to help the lives with using this geomapping. I request a very nice and congratulations to you for joining here as a resource person of this international event organized by Department of Geography of Shri Kumarswami Mahavidyalaya, Ausa, District, Latur, Maharashtra. And I welcome to all the participants, those who are willing to discuss on this topic with our resource person. Welcome to all. Please unmute one by one and discuss with resource person. Please. Anyone can unmute and discuss with the resource person about the geography mapping, what you are having any queries in your mind, or if we want to discuss with her. Please.
Sir, my question is there.
Yes, sir. Yes.
Can I sound my audible?
Yes, sir. You are audible.
Yes.
You can discuss.
Yes. When we go to the terrain landform, at that time, suppose we have a propose land use mapping. At that time, how this technique should use in the terrain landforms, especially in hill areas, sir. Madam, please.
Please unmute yourself.
Your sound is not audible. Please. Yes.
Dr. Bekar, can you clarify the question? Are you asking if you look at a particular area, what should you do prior to building or creating anything in that space?
Yes.
Sir,
in particularly Himalaya ranges, the sloping side of the Himalaya ranges, or western coast slope area. especially in Konkan area.
Sir, in generally, we may ask if there is hilly area where there are so many valleys. At that critical geographical conditions, how you organize the mapping? I think he was asking the same collection of
For
the data.
small patches we have there, and the agricultural pattern is varies from small patterns regarding the slope according to the slope. At that time, suppose we have used that technique. So how we use the technique? That is my question, because this technique is very useful for the useful in flat area.
Okay. So those data sets, the instrumentations, there's a number of various instrumentations to bring down the data. If you're looking at land or air or water or people. So it's really going to be relevant to what your focus is. If it's absent of people, you're just looking at environment, then you would use the instrumentation to look at the parts per million, say in air quality, right? Or in the parts per million in the water quality, if water is the primary source of focus. But you really have to kind of focus in on what's the first stages. And that's why you have an interdisciplinary team, because they will bring to point what needs to be factored and considered. Like the epidemiologists may evaluate the slopes in the area to be a risk because they retain moisture and there's not a lot of sunlight and the number of hours of sunning that actually help ward off bacterial infection, okay? But if there's not a lot of sunlight hours, then that will be his recommendation. But then you may have an input from the other expert on whether or not the air quality, because of the, let's go from, let me make sure, I want to make sure I say the elevation, because you're saying that the land is slopes, right? So depending on the elevations as to where you want to go, your barometric pressure and your air pressure are all going to be factors on the air quality. Okay. So this is the benefit of having a mutual team. There's not a one answer per se when you're doing geo mapping. It's necessary to have the input based on what your situation or what your goal is. So if your goal is, if you're responding to a critical incident, then you would use this type of data set. If you're planning requires a different angle of preparation. I hope that answers your question.
Yes, thank you, ma'am.
You're welcome, sir.
Thank you.
Anyone from Geographical? Thank you, Srikant Gaikwad sir, for discussing with this important question. Anyone from participants, will you want to continue discussion? Please unmute yourself. Any point about the regarding health geography or any geography which you are also having expert in that field also, we will discuss this top point here also with the resource person, madam. Anyone can, geography teacher can unmute themselves. Actually, we are conducting this running international webinar, international conference, e-conference on the geography. The research scholars, teachers, research supervisors and academicians have joined from geography and other fields also, because geography is not only the subject of a teaching one, but it's a subject of life also to those who are live on this earth. So your topic covers the healthcare, data collection, how we that hygienic conditions, environment, air, water, all this data you have explained here. So with this regard, if someone want to discuss or with the resource person, they can unmute and please discuss with the resource person, madam.
Very good afternoon and good morning to USA. Good evening to USA and good morning to Hyderabad, that's India. I am Professor Badiuddin Ahmed. I was listening to your lecture. It was very wonderful and very informative. Though I'm not from geographical background, but it is necessary for non-geographical persons also, because you highlighted mostly on the what you call health issues, environmental issues pertaining to the geographic. And It's really good to learn about geography and its impact. How does it affect it? And this basically you made the point how the garbage is being thrown out and how this the condition of water also, especially water and pollution. This point which you have raised really makes sense of this what you call conference, and we the participant have to really get benefit out of your very extreme important points which you gave us. And my question is that what is condition of developing nations as per geographic mapping? Was in fact you can call least developed nations or least developed countries or undeveloped nations, how they are making use of that? America, of course, a developed nation, it's true, they can, but how about a country like India?
So if you're saying, you're asking how would that apply in India?
Yes. I mean,
Yeah. Okay. It will be the same, because the basic elements of the environment are still, water, land, and air. So the same tools that are utilized in the United States, and the World Health Organization is global. So if you reference that statistical research, you will see that they actually did a global utilization of the mapping and data sets. It wasn't just for the United States. I only utilized a case within the United States that I was aware of to highlight the opportunities of utilizing geohealth and geomapping. But it is utilized globally, and so it has not been integrated into India on a larger scale. Then that's an opportunity to reach into, such as yourself, to the World Health Organization and ask for some support and or guidance, because they will render that guidance and start supporting your area respectively.
can we have collaboration geographic with the non-geographical disciplines like engineering, collaboration, or sort of can we work together, though we are not from geography, with the geographic, using our discipline with geographic, and put together, can combine these two disciplines?
Yes. Yeah, I don't see why not. Because like I say, the basic elements are still the basic elements no matter what region you apply or collect the data. It's still going to be air, land and air are the same, and water are in every quadrant. And those are the primary sources in which things are carried, either airborne or pollutant or contaminant or gaseous exposure is going to come down to those three: air, land, and water. And so for that reason, that is why the primary data sets surrounded around those four elements of those four components for the GIS model.
Thank you so much, Professor. Thank you so much for a wonderful explanation for the queries. Thank you so much.
Thank you.
Thank you, Dr. Badruddin Ahmed sir, who is Dean of the Management from Hyderabad University and daily joining respected academician of this webinar series and every program of our college. Thank you, sir.
Thank you.
Nice question, nice discussion with resources, madam. If you have time to stay, then you can stay, because this discussion may be continued after this also, but other resource person have not joined, so we have some time with discussion, so we can discuss. If you have no time, we will continue this as per your opinion. We will continue this.
As your other resource officers, they have not presented?
Yes, they are Monday, Sunday, this mismatching with that day and calendar, they are having trouble. So they will join on Monday. No problem. We will welcome them also. But
Okay.
you have celebrated
Well,
this.
what I would like to do is, like I share, I would like to encourage them to review their sources, the resources, especially that World Health Report. It is really informative. That was on the presentation earlier. The surveillance report, the data that came with that global data, and I showed earlier in the presentation. That's a great reference point, and you can see, and it's probably up 40 pages of data, how they broke out and actually looked at not only just the geo in regards to just water, air, and quality, but also by infant mortality and how it affected some of the maternal progressions in pregnancy. And there were a few other specific studies by disease and condition that you will be enlightened by. And it may change your perspective and focus in your region as to how geodata or geohealth is being utilized or implemented. So I encourage you to do that. For the sake of the morning hour here in the United States, it is 1:30 in the morning, a.m. And for the time's sake, I would need to depart. And I do enjoy any other questions before I go. But this has been nice to be able to present for you.
Thank you, Andrew, madam. If someone want to discuss with this person, we will also he will also stay for the answer. All the organizing committee members are requested to make camera on. We have to take screenshot with our resource person, Deshmukh sir. Yes. All organizing Lahane sir, Astore sir, please make your camera on. We will take screenshot, and the participants also are allowed to do camera on.
Sir, may I want some additional information from the madam side?
Yes.
Can I ask?
Yes, sir. Yes, please.
Yes. That is the having a much more time. That's why I'm asking to the madam.
I can probably take one more question. I only have 5 minutes.
Okay. In your field, so many potentialities, job potentialities is available in your field. In our field, especially in geographical mapping. So, who are the youngers? Means who are the justly joined in our field, otherwise who have completed their geography post graduation and they want to join in the geographical mapping field. What is the opportunities in this field, which is much more information having from your side rather than us, because you have do the depth study regarding the geographical mapping. That's why I'm asking to you. So, what is the much more opportunities for the just as like a job to the younger students or younger geographers? So they want to just join. They have technocide persons, but where they have joined, they don't know. Therefore, I'm asking to you, please.
Okay, so in regards to career and how to utilize their geography career in the health geographic space, right? That's your question, right? How do they enter the career field? As I share with you, in geohealth, there's different disciplines that participate. There's epidemiology. So now that they have the geo space, they can expand their knowledge and take a few courses in epidemiology so that they'll have a broadened understanding of how these two work together collectively to contribute to the geohealth. That will position them to actually be a part of the team, because if everyone is just focused on space, because it takes a lot of information. I mean, you need persons that have expertise. Say like I'm a pharmacist, okay? I'm pretty much on medicine, but I like computers also. So I have a dual mental set, a dual knowledge set that I can apply my clinical knowledge in right presentations and studies, etc. So I encourage them also to expand to another skill set so that it makes them viable to enter. There's not one particular thing. I can redirect you to, like I say, the resources, the International Surveillance and Disease, as that reference. That organization, they look at, they have utilization of geography students and internships that they could possibly allow them to do that. And some of them are by distance. You don't actually have to be on site. So that's opened up a lot. And the same thing with CDC, that the Center for Disease Control. I'm not sure what organization you have that oversees India Health. Do you have an India Health organization?
Yes,
If
yes.
you, yes, right. So the India Health Organization, any of those participants can reach out to the World Health, and they will give construct of guidance of where your instrumentation can be utilized. They will mentor, collaborate, and support any programming. But as far as career entry, there's a lot of opportunity. It's just a matter of getting connected to at least one entity that, has an avenue that they're already being active. And right now, the World Health Organization, as well as the CDC, the Center for Disease Control, ISDI, and there are a few others. There are about four others that are on a higher platform that they would need to reach into to see. But it's a lot of opportunity and a great need, a big need to have researchers out that contribute and look at all angles of the factors so that that nothing's missed. That's where you say, okay, you're looking at the sloping, like the gentleman made reference to the slope, but the other one says, no, we also need to look at the sunlight, how much region of sunlight. And then one contributes and say, well, we also need to do air quality, see how much humidity and moisture is in their respective space. So they can absolutely join a team collectively, and it's a big career opportunity. So I'm sure you'll do well.
Thank you, Andrew, madam.
Thank you.
Uh,
Thank you, madam. Thank
it's
you very
You're
much.
welcome.
it's your time of rest, but you still
Yes.
joined here. So we are thankful to you from all my organizing team, all the participants, all my institute to you. Okay, you can take rest. We will continue this as a presentation, and in future also we will invite you for sparing your time. You can join here. Thank you.
Thank you. Nice meeting you.
Welcome. Thank you to all the participants, those who are joined here. Remaining resource person will join tomorrow because Monday, Sunday, that was the uh, timetable for different countries. Day is different. Because of that, we just organized this one speech, and after that, we will continue our presentations. Those who are ready for presentations, I will hand over this to the Dr. Professor Prakash Karad sir. Please continue the next session of presentation. I am here with you.
Thank you, sir. Now, after the illustrative and informative speech by the Honorable Keynote Speaker, now we